The journey to becoming a safe and competent physician who provides high-quality patient care is full of challenges and achievements. Two major milestones include completing the USMLE Step 1 and Step 2 exams. As a student, you may feel that the skills, knowledge, and dispositions modeled in class to prepare you for clinical practice and success in school are different from the ones needed for the STEP exams. But we are here to present a different perspective. In reality, the skills and knowledge necessary to solve clinical problems and to diagnose and treat patients are the same as those required to answer complex STEP exam questions that usually begin with case vignettes. In other words, focusing on the practice of medicine and developing the skills and knowledge necessary to provide high quality patient care can also optimize your preparation and performance on STEP. The way you think about questions and figure out the correct choices are tied to the skills we practice in class. In short, the integrated respiratory cases presented across HP2, HP3, and S3 are designed to help you establish a framework to recognize clinical presentations, gather, organize, and interpret relevant information, and apply solutions to clinical problems. The same methods are necessary to analyze case vignettes to answer STEP exam questions and care for patients in the future. My name is Dave Harris. I am a physiologist and module director for HP2. I'm here to give you an overview of the integrated respiratory cases so you will know what to do and expect when completing the integrated respiratory case activities. At the end of this introduction, you will be able to access videos that will give a short overview of each of the main tools that will aid you in organizing and illustrating your knowledge for each integrated case. But first, I'd like to introduce you to my colleagues who helped author the cases and will be mentoring you through them over the next 12 months. Dr. Nyla Dill is an immunologist and medical microbiologist who directs the HB3 Health and Disease module. Dr. Feroza Dalwala is a practicing pulmonary ICU clinician who co-directs the S3 cardiopulmonary module in the internal medicine clerkship. All three of us will be guiding you through the integrated respiratory cases presented in HV2, 3, and S3. In addition to the faculty, I'd also like to give a shout out to other members of the core research and development team who contributed directly to the design, development, and testing of the cases, including our Class of 2022 student designers, Tyler, John, Ben, and Julia, Class of 2021 student designers, Paul, Levy, and Courtney, our team of instructional designers, Andrea, Emma, Luke, and Dr. Tusi Harumi, our educational technologist, Melissa, and graphic artist, Zach. You will now return to the main menu where you should begin by watching the integrated cases and resources video. During the first 2 years of medical school, you will be presented with many concepts about human physiology and pathology that may seem disconnected from patient care, as presented in books, lectures, and self-learning modules across modules. The integrated respiratory cases are designed to bring these seemingly disparate worlds together by presenting you with 1. Materials and experiences that are designed and delivered in a consistent manner across modules, exercises that illustrate the relationship between basic science concepts and patient care, and patient cases that increase in depth and understanding to extend your knowledge of basic science and patient care. During HB2, the Structure and Function module, you will be studying 2 obstructive lung diseases and 2 restrictive lung diseases. During HB3, Health and Disease module, you will be revisiting asthma and increasing your knowledge of pulmonary disorders by examining various causes of pneumonia, which is an infection of the lung. During S3, the cardiopulmonary module, you will revisit the same respiratory disorders by examining similar disorders from a patient's perspective. The respiratory cases are designed to build on each other by elaborating on your knowledge of the pathophysiology, signs and symptoms, epidemiology, time course, diagnostics, treatment, and management of specified disorders across the modules. Several learning resources have been integrated with the respiratory cases to provide consistent learning experiences across HB2, HB3, and S3 as described in Table 2. Specifically, The respiratory cases and related assignments will be presented through UCF web courses and CoraCloud. Curated lectures along with recall questions will be provided through Lecturio, a medical education learning platform. These resources help you acquire knowledge and assess your acquisition of important respiratory concepts. You will also be given access to Draw.io to help you generate, revise, maintain, and expand mechanism of disease maps and illness scripts. At this point, we are assuming that you are familiar with and know how to access assigned courses through web courses. Next, you will see screenshots on how to access and use basic features of Lecturio and Draw.io. For a more detailed tutorial on the use of Lecturio, please go to the link provided in web courses. First, let's take a quick look at the basic features of Lecturio that we've activated for the integrated respiratory cases. You may access curated Lecturio videos and resources either through web courses or through your own web browser. Either way, here is a screenshot of what you will see the first time you log on to Lecturio. Log in with your Knight's email address. When you log in, we also recommend that you click the Remember Me so that you don't have to retype your login information. If you access Lecturio outside of web courses in a different browser, please be sure to enter ucf.lecturio.com. Do not log on to lecturio.com for this module. You should always see the UCF logo. Once you log in and access the UCF Lecturio homepage, you will see and use 4 primary features. The navigation bar to readily access all functioning features, assignments with curated videos, recall questions, articles, and quizzes with recommended UMSMLE style questions, spaced repetition to review assigned questions, and performance to monitor your progress toward completing all assignments and questions. All Lecturio videos are taught by award-winning faculty members and have been curated specifically for you and the module. At the end of each video, you may also complete recall questions to test your knowledge as well as read articles for more information about the topic. By answering recall questions and selecting your degree of confidence, you will also help program the system to provide appropriate spacing for repetition. You will also receive immediate feedback on your answers and monitor your progress. By selecting Performance, you may monitor your progress and see how well you are doing on the assigned videos and recall questions. Now, let's take a look at how you access Draw.io and create and maintain mechanism disease maps and prototypical disease scripts. To create mechanism disease maps for the integrated respiratory cases, access Draw.io by typing in the URL. Then select the storage device you want to save your mechanism disease maps, such as Google Drive or OneDrive. You will then be prompted to either create a new diagram or open an existing diagram. You may also change your storage device at this point. Once you've entered Draw.io, create a unique title for your new mechanism disease map, and then select Create. To create a mechanism disease map, first select all shapes for your diagram using the General tab. Then choose Connecting Arrows using the Arrows tab. To export your mechanism disease map, select File, scroll down to Export As, and choose to export it as a PDF. You will be uploading and submitting your individual and team mechanism disease maps as a PDF through the Assignments page in web courses. Mechanism of disease maps are essentially a graphic representation of the abnormal physiology behind a given disease. They depict the relationships between underlying pathophysiological mechanisms and the related patient presentation, including signs and symptoms. Figure 1 conceptually depicts how an inciting incident or insult highlighted in the blue box can lead to causal pathophysiological mechanism in the green boxes that result in signs or symptoms of a disease in the red boxes. The mechanism of disease map helps you see the underlying mechanism of a disease rather than just memorizing its components. This type of process-based learning that asks you to both illustrate the relationship between and explain what you learned will enhance your understanding of causal mechanisms as well as relate anatomical, physiological, histological, and other scientific concepts to clinical presentation. Now let's take an example together. Take a look at this clinical case vignette. To create a mechanism of disease map, you will start by identifying important signs and symptoms to determine where your mechanism disease map should conclude. Now let's take a look at the mechanism disease map for the case should look like. We'll start by identifying the initial insult. From there, we will identify the causal mechanisms and eventually lead to each sign and symptom. A good mechanism of disease map that meets module expectations, like this one, is well organized, free of misconceptions, and clearly identifies and correctly orders the sequence of relationships between all symptoms and causal mechanisms. Now let's see what a developing mechanism disease map looks like that does not meet the module expectations. The mechanism disease map depicted in Figure 3 is lacking in several areas. First, it appears that an explanation of skin tenting is not present, so it's missing signs and symptoms. Second, there is not enough detail between each box. In other words, the relationship is not clearly identified, which could indicate a lack of true understanding or not allow the faculty to assess your understanding. Third, certain functions are absent, in this case venoconstriction and activation of the renal angiotensin system. Compare the previous good example and this developing example to help you generate an individual and team mechanism of disease map. As you gain knowledge of basic respiratory concepts and human pathophysiology, your mechanism of disease maps of each disorder will become more elaborate. For instance, the clinical respiratory cases presented in HB3 will build on more and more cases presented in HB2, extending your knowledge of respiratory anatomy, physiology, histology, and immunology. In S3, you will add to and elaborate on your knowledge of respiratory disorders by synthesizing information about diagnostics and the management and treatment of the disorders. Such information may be integrated into your mechanism of disease map and should be added to your prototypical disease scripts. Over time, expert clinicians develop a complex network of illness scripts to diagnose and treat patients, as well as provide patient care. As they encounter and examine more patients, they shift through the scripts in their minds and retrieve relevant information from long-term memory to create a differential diagnosis. Clinicians form illness scripts in their minds to organize knowledge of disorders derived from books, journals, and other academic resources, and from experience gained from diagnosing and treating patients. The development of interconnected illness scripts facilitates clinical reasoning by fostering knowledge integration and synthesis. As a medical student, your expertise will progress through a distinct stage of development, each characterized by qualitatively different knowledge structures that underlie your ability to diagnose patients presenting with different disorders. During the early stages of medical school, you will develop elaborate networks of concepts primarily from textbooks and lectures that explain the underlying pathophysiological processes associated with common disorders. With repeated application and increased exposure to patient problems, you will encapsulate your causal knowledge into higher-level diagnostic labels. For example, with repeated exposure to patients presenting with chills and fever, you may examine the patient and simply explain that the patient has developed sepsis. The concept of sepsis is sufficient to explain all relevant signs and symptoms. Sepsis encapsulates more detailed underlying causal mechanisms that you learned in stage 1. Then, with extensive experience, your encapsulated knowledge will be organized into narrative structures referred to as illness scripts. Illness scripts contain relatively little details about the pathophysiological causes of signs and symptoms because they are encapsulated, but they do contain a lot of clinically relevant information about the enabling conditions of a disease and the variability in the signs and symptoms in which a disease may present itself. For HB2, HB3, and S3, you are to elaborate a series of prototypical disease scripts that correlate basic scientific knowledge with clinical practice by illustrating the causal relationship between prototypical signs and symptoms and their underlying pathophysiological processes. The scripts will serve as a strong foundation for advancing your clinical expertise as you encapsulate knowledge of cause mechanisms and develop complex networks of illness scripts. Figure 5 depicts the basic components of a prototypical disease script. Prototypical disease scripts help you organize, maintain, elaborate, and apply your knowledge of common signs and symptoms, pathophysiology, epidemiology, time course, diagnostics, patient education, management, and treatments associated with various disorders. In HB2, you will generate mechanism of disease maps for several respiratory disorders and focus on synthesizing information about the prototypical signs and symptoms and their underlying pathophysiological processes by filling in related components of the prototypical disease script. In HB3, you will build on the mechanism disease maps and prototypical disease scripts for various respiratory disorders by elaborating knowledge of the prototypical signs, symptoms, and underlying physiology, as well as synthesizing knowledge about epidemiology and the time course of each disorder. In S3, you will continue to build on your knowledge of respiratory disorders by synthesizing information about diagnostics, patient and family education, and the management and treatment of each disease. Here is an example of a prototypical disease script. It consists of the mechanism disease map in the center and key components of a disease script on the outside. To complete and elaborate on the prototypical disease script across the modules and over time, you are to fill in the components with what you know about the disease. In this example, the signs, symptoms, and pathophysiology component is filled in as well as mechanism disease map for heat exhaustion, which is embedded into the center of the script.